So welcome back. This is episode 229. This week, I'm joined by Medicare expert and Boomer Benefits co-founder, Danielle Roberts. And she's here to talk about Medicare Open Enrollment and some of the mistakes that you want to make sure you avoid. And Danielle is also an author. She's the author of 10 Costly Medicare Mistakes You Can't Afford to Make. And be sure to listen to the end of the episode, as I'll let you know where you can get a free copy of her book. So welcome, Danielle.
Thank you for having me. My pleasure
It's great
to
have you back. We had you on probably about 2 years ago. We ran through a lot of the Medicare, basics and really getting a good handle on that. You got a lot of good feedback on that. Good.
Well, we had some changes since then, so
we'll
be sure to cover those.
Yeah. So as we are in open enrollment, right? I figured we're getting towards the end, but there's still some time. So kind of run through that. So maybe for people that don't know, like what is Medicare Open Enrollment?
So Medicare has several policies or parts that they allow enrollment in a specified period during the year because those coverages don't have any health questions or underwriting. So to prevent adverse selection, where people wait until they get sick to buy the coverage, they limit your enrollment. So in the annual election period from October 15th to December 7th, this is the time of year when you can enroll in, change, or disenroll from either a Medicare Advantage plan or a prescription drug plan. So those are the two types of coverages that you want to look at, because when Medicare releases the annual updates for the next year's deductibles, copays, and coinsurance, then those Medicare Advantage plans will necessarily have to shift their benefits to include those changes. And so these plans, both Part D and Medicare Advantage, they mail you an annual notice of change in September about your current Advantage plan or drug plan. You want to really look at that carefully, make sure there's nothing changing for next year that would be significant for you, such as the plan dropping one of your important brand name medications. And then if everything looks good, you can just let your plan renew. Most people, though, will review it, and then if they have questions, they reach out to their broker. And if something big is changing, they can use the annual election period coming up in October 15th to December 7th to make a change. They can switch to another plan that may cover that. They can disenroll from an Advantage plan and go back to original Medicare. So there's a number of moves that they can make. And so it's the busiest time of year for beneficiaries and agents like us. Phones ring off the wall with everybody wanting to know. That's exactly right.
So last week, I talked about like the Medicare premiums for 2025 and a little bit about IRMA. So for those that didn't listen, I think it's $185 is just the standard Part B premium.
Correct.
And then like the Part A deductible went up slightly. So, if somebody's maybe new to Medicare, like, do you need a supplemental plan, or could you just not have one?
So that you could just have original Medicare and not add any type of other coverage like a supplement or Advantage plan. The downside to that is that Medicare has coverages that require cost sharing from you. So this means a deductible, which next year will be $1,676 if you go in the hospital. If you're in the hospital past 60 days, you start picking up an expensive daily copay that gets larger with time, and then
that's
your
like
benefits run out on day
or something.
150.
Is that what it's going to be? It's right around there.
Yeah, and the 90 days. It starts at $419, and then I think it goes to $838 next year. And, most people are not going to be unlucky enough to be in the hospital on the 61st day, but we do see it from time to time. The bigger thing is on the outpatient side, Medicare pays 80% and you pay the other 20%. And unlike insurance, you've had under age 65, there's no stop loss on the 20%. So 20% of something like a lifetime of dialysis or chemotherapy, radiation, oxygen, durable medical equipment, this can be very expensive. And so that is why when Medicare was first created in 1965, almost immediately Medigap companies created Medigap plans to cover those things for you, to pick up that deductible, to pay those daily copays, and to give you an extra year of hospital coverage that's covered. And so that is why people would enroll in them, just so they don't have that exposure.
So, if somebody, let's say they went into a Medicare Advantage plan, right? That can be popular because that can cover your prescription drugs and sometimes dental and vision too, right? So they get a notice this year that maybe last year it was free, and now it's going to be, $150. So what would the thought process be about that?
Yeah, we don't normally see premium jumps that high, although it is possible. So with Medicare Advantage plans, when they change every year to reflect the benefits that have changed in Medicare, they also are incorporating any type of changes that has happened in CMS regulations. So a couple of things happen that are important right now in terms of pricing of Medicare Advantage plans and drug plans. We had the Inflation Reduction Act, which brought the cap on drug plans from $8,000 down to $2,000. Okay. That means your insurance carrier is absorbing a lot more of your drug costs. So you may notice that the formularies get slimmer. And that's a really important reason to look at everything in the fall, right? But you would also want to look and see, let's say you did have a Medicare Advantage plan that had a zero premium, and maybe it goes up to, say, $20, or more likely what's going to happen is when they change, because CMS funding changed in that 1 year, and they might come out and say, well, this year the dental benefit is going to go from $1,000 down to $250, or they might drop the vision coverage or the gym membership. They will first usually kind of get rid of some of those ancillaries. But the other thing you really want to look at in that is, what are your doctor copays going to be? Was there any significant jump in those copays, and how often are you using them? If you're not using them very often, that may not matter. But looking through that summary of benefits provided to you by the carrier, look through it and find the healthcare services that you tend to use the most, and see if any changes are there that are alarming to you. And of course, checking the medications is my number one, because especially this year when those formularies kind of got slimmed down, you may find that drugs that you had access to before you don't, or maybe they've added a restriction on them, like a quantity limit or prior authorization or step therapy, which means it may be harder for you to access next year.
Sure.
And that is one of the most important reasons why they allow you to make a plan change every year.
Because I've often heard, because firsthand, I don't sell Medicare policies, but that companies, if they're coming into a marketplace to get people to sign up, they might offer a Medicare Advantage plan for very little cost, if not $0. Is that still happening?
Mm-hmm. Yeah, because when you enroll in a Medicare Advantage plan, Medicare pays the Advantage company over $1,000 a month plus bonus payments to deliver your health risk. And that's why they make so much money, right? Because there's always more healthy people than sick people. But yes, that there can be a change there. And so if something is offered for $0, that might be really attractive. Sure. And it is something that could go away next year. So you're absolutely right.
And so that's, during the open enrollment, that's your opportunity to change plans.
That's correct.
So, go ahead.
One thing I would also mention, just that's kind of important, is open enrollment in the fall, the annual election period, has nothing to do with Medigap. So if you have a Medicare supplement or Medigap plan, it is not changing in the fall. You don't need to shop it. They're not going to send you a new rate.
Sure.
Medigap plans don't change from year to year like Advantage plans do. So the time of year when you would want to shop your Medigap policy is when you get a rate increase. And that's usually prior to your policy anniversary.
Okay.
And then you could reach out to an agent and you can apply to change your Medigap policy any time of year. In most states, that's going to require some underwriting. But some people will think that if they wait till October 15th and apply for the Medigap, that they get to skip the underwriting. And that is not the case, because the annual election period is not about Medigap. It's about Advantage plans and drug plans.
So when is your anniversary usually with your Medigap policy?
Well, for a lot of people, if they set their Medicare to start on the first of the month in which they turn 65, they enroll during the enrollment period, they will usually have their Medicare start on the same day as their Medigap policy. So a lot of times you're getting that annual increase 1 to 2 months before your birthday, right? Because that's when you originally signed up for Medicare. But somebody could shop a policy at some point and their new policy, let's say, starts in February. Then every year in February, that's typically when you'll get a rate increase. You can get rate increases several times a year or more often than that, but that's the most common. Is typically you can expect a 13 to 15% rate increase every year, and it's usually sent out to you in the mail around that policy anniversary.
So, we've talked in the past about Medigap, right, versus Medicare Advantage. But just if somebody, doesn't understand, just briefly, like quick summary of Medigap versus Medicare Advantage.
Sure. Yeah, so this is the big question, right? Like, which route are we going to go with Medicare? Something important to know is that you can't have both. You're going to choose one route or the other. So with Medigaps, also called Medicare supplements, same thing, just two different terms. With these plans, the reason that most people enroll in them is they offer freedom of access to any Medicare provider nationwide. So this gives you access to 1 million providers. You don't have to choose a primary care doctor. You don't have to get a referral to see a specialist. It works great if you travel or snowbird or live an RV lifestyle because it's going to be going with you anywhere you go. You stay in original Medicare and you're adding the Medicare supplement. So what that does is Medicare gets a claim for one of your healthcare services. Medicare pays its share. And then instead of sending the remainder to you to pay your 20% and any deductibles, copays that are owed, it sends that remainder to the Medigap company, and the Medigap company pays on your behalf. And then you will only get a bill in the mail if there's anything left over based on the plan that you chose. So it's more expensive coverage, but it's more comprehensive on the back end, more predictable. There's less surprises with this type of coverage. But it's the most expensive, and also it has rate increases each year. So Advantage plans are kind of the opposite. They have low premiums because remember, they're getting paid by Medicare instead of charging you the premiums. And these plans, the trade-off for it being so inexpensive is that you will use a network. So a Medicare Advantage company will come into an area, contract 10 or 15,000 providers. Those providers agree to treat the members of the plan at discounted rates. So you enroll in an Advantage plan. They often have networks like an HMO or a PPO, and you want to carefully look to see that your doctor's in the network, your drugs are on the formulary, and that this plan has costs that you can afford. The worst way to enroll in an Advantage plan is via a TV commercial. A lot of times those are gimmicks. They promise benefits that once you get on the phone will be a bait and switch. So with Medicare Advantage, the reason they're so popular today, 55% of all Medicare beneficiaries are now enrolled in a Medicare Advantage, is those lower premiums. And because they make so much money from Medicare, they include extras that Medigap doesn't have. Things like dental, vision, hearing, and gym memberships.
And prescription drugs too, right? Because if you go with Medigap, you've got to get a prescription drug plan and pay more per month for that.
That's correct. 97% of Medicare Advantage plans have a built-in Part D, which is great. You won't pay anything separate for it, but you just want to make sure that that built-in Part D has your drugs on the formulary, because otherwise you would pay those out of pocket.
So I think, with Medigap, you have standardized letter plans, right? And it dictates like what's covered. I think as Plan G, it's the most comprehensive that somebody could buy now.
Correct. Yes. Yeah, there's 10 standardized plans you can choose from, but a lot of the insurance companies don't offer all 10. They typically tend to offer the most popular, and Plan G and Plan N are the two most popular. They're also the two most comprehensive for people new to Medicare on or after January 1st of 2020.
So let's say you went on Plan G with Cigna. I don't know if they offer it. We'll just say they do. And then they do a rate increase, and now what's a typical rate increase? Like a 10%?
So, it used to be 5 to 8%, but the costs have gone up considerably since then. So it's more common for us to see a rate increase around 15% per year. So when you're looking at Medigap coverage, you need to think about, can I afford this now? And assuming I get a 15% rate increase every year, can I afford it over the long term? If you're healthy and you can switch from one Medigap plan to another without underwriting, then you can always change. You can shop it every year and see if anyone else is offering that Plan G for less, and you can make a plan change. But in most states, that's going to require you to answer a whole page of health questions. The underwriter will look at your medical records, they'll pull your prescription records, and they can accept you or decline you. And so you need to think about all of these things up front, because if you're coming into Medicare, you have a one-time window, 6 months from your Part B effective date, to enroll in any Medigap plan in your zip code with no questions asked. If you have a health condition that is treatable but not curable, something like rheumatoid arthritis or congestive heart failure, those kinds of things, that 6 months may be the only chance for you to get a Medigap plan. So you'll know the premium going in, and you need to count on roughly 15% increases every year.
So what I was going to ask is, let's say like Aetna has a cheaper Plan G. You can't just go into that because of what you're saying. You're going to have to go through underwriting with Aetna. And if something came up, or maybe it was there to begin with, but it wasn't able, you weren't able to be denied in that 6 months. Now you're stuck with Cigna, in my example, and the rate increases.
It's possible that could happen, yes. And that is the way that it is here in Texas and in many other states. There are a few states out there that have year-round open enrollment, which means they don't do any underwriting.
I think Connecticut's one of
states
them,
like
right?
New York.
Where I live, yeah.
Yep. New York, Connecticut, Vermont, and Massachusetts, they all have that. That's great in terms of getting coverage, but the downside to it is the rates are so expensive in those states because when they can't underwrite out the sick people, they have to raise the rates on everyone. So, for instance, if you live in New York, it's one of the most expensive Medigap places in the nation. And it's something to consider because you're going to start at a higher rate and you're also going to have the rate increases on top of that.
So I haven't looked in like a year, but last time I looked in Connecticut, like Plan G was around like $210 a month. So you're saying like other states that Plan G plan would be a lot less, like in Texas?
That's correct. Like a female turning 65 here in Dallas-Fort Worth, she could probably get a Plan G for between $100 to $120 a month.
So what if you are retiring in one state, like in Connecticut, for example, but you're planning to move to Texas? Are you able to keep your Medigap plan if you move?
Yes, your Medicap plan will go with you anywhere in the United States. The only thing that will happen is it's going to change to whatever zip code is offered in the state that you go in. So if you were going from Texas to Connecticut, bummer, you're going to pay more for that same coverage. But if you're going from Connecticut to Texas, you'll be pretty excited at your decrease.
So it goes both ways. You can either save or you can pay more. You don't lock in,
Yes.
So if you do have that, right, you're in one of those states where you can change. Is it any more beneficial to look at the change during this period now, the annual open enrollment?
Well, no, because the annual election period doesn't have anything to do with Medigap plans, only Advantage plans and drug plans.
But is it advisable if you are in one of those 4 states where there's no limitation, just and your health was good when you're going on to Medicare, to maybe go into a Medicare Advantage plan because it's less costly?
Yes. Like, for example, we see Florida also has pretty high Medigap rates, and the Advantage plans down there are just stellar with really low premiums and copays. So in those states, sometimes it just makes sense to do an Advantage plan because the cost is so steep, especially for people that are coming into Medicare pretty healthy. They don't use a lot of healthcare services. They don't really want to spend $250 a month on a Medigap plan when they're not considering that they may use it. Now, we never know what's going to happen in the future, but Advantage plans all have a cap to protect you. And so I think that's one of the reasons they've gotten so popular. As Medigap premiums have increased over the years and the Advantage plans haven't, they just become more and more enticing to folks out there trying to live on fixed incomes.
Tell me about the cap. How does that work?
So with Medicare Advantage plans, they're very similar to group health insurance you've had when you were under 65. You have a summary of benefits, you open that up, and it will tell you exactly what you will pay for each type of healthcare service, right? So it might be a $20 doctor copay or a $200 in an Advantage plan, right? And you're going to review that and see, can you afford those treatments and can you afford the maximum out-of-pocket limit? So because Advantage plans have you paying things on the back end, let's say you have a plan and it's a $30 copay to the specialist. The plan has to track all of your out-of-pocket spending on Medicare Part A and B services, so inpatient and outpatient coverage. And if that spending hits a certain limit set by the Advantage plan, then you're done spending on those services for the year, and 100% of your costs will be covered for Part A and B services. Drugs are separate, and you have a separate cap for those. So in 2025, the maximum that cap can be for in-network services is $93.50. If you have a plan that has out-of-network services and you use both in and out-of-network, it'll be higher. It could be $11,000 or something like that. And this is something to think about. Like, if I were to have kidney failure and be on dialysis, can I afford to come out of pocket $93.50 in a year? And if that answer is no, you might be better served by a Medigap plan, or you can work with your broker to look at all the Advantage plans in your area, and we may be able to find you a plan with a $5,000 limit. So the plan can't set a maximum out-of-pocket higher than $93.50, but they can lower it, and many of them will because they're competing against other Advantage plans for your business.
If you go with Medigap, what is your maximum out-of-pocket in that case?
Well, Medigap plans don't need a cap because they pick up immediately after the deductible, right? So for instance, on a Plan G, you're responsible for a $257 deductible in 2025. And then after that, Medicare pays 80% and Plan G pays the other 20%. So there is no cap. You could have coverage on that endlessly, no matter what you go through, as long as it's a medically necessary service that Medicare
So in many
approves.
instances, you're just paying the premium in the 257. That's per year. Let's say Plan G, right?
That's right.
And that's your maximum out of pocket that you'd probably have.
It is, with the exception of on your drug plan. Of course, you'll have copays and spending on
How does that work with the drug plan? So you pay around, what is it, around $30, $40 a month for a Plan D?
Yeah, so Medicare Part D, all drug plans have to meet certain guidelines and they have to cover certain classes of medications. This could be like anti-cancer, anti-seizure, antidepressant. Beyond that, they only have to offer 2 medications in every therapeutic class. So you can get a really cheap drug plan. It could be in some states as low as $0 or $5. But in that scenario, you most likely have a higher deductible, potentially higher copays that you'll spend on your plan, and the skinnier formulary. If you find a plan in the $40 to $60 range, I tend to think that those are among the most healthy. That's what I put my own parent on. My father is on a plan. I wouldn't enroll him in a zero premium drug plan, because I want to make sure that drug plan is robust and has lots of medications on there. And so, yes, I would say to ballpark $40 to $60 for Part D. And if we can find something cheaper that covers your medications, great. But you want to also think about that drug plan is going to cover things for you that are unexpected. And we don't know what's going to happen with our health tomorrow. We can only change our drug plan once a year. So we want to make sure we're getting a plan with a nice, healthy formulary for those unexpected drugs that you may need in the future.
Is there an out-of-pocket? So there's no out-of-pocket limit, I guess, with a drug plan then?
There is, actually. So it used to be that you would hit the limit and then you still had to pay 5% of your prescriptions for the rest of the year. The Inflation Reduction Act changed that. So this year the cap has been $8,000, and next year it's going down to $2,000. So significant change in. It's going to help people with a lot of medications or a lot of brand name medications. The downside, of course, is now that the carriers are paying more, I think we're going to see greater rate increases every year on Part D. They'll probably make that up in some of the premiums.
So just like you were saying, with a Medicare Advantage, you can change once a year, right? It's the same thing, prescription drug plan. You said that's once a year too. Okay.
That's correct. Yeah, they allow you to change it every year just because they know that your health and medicine needs may change throughout a year. So you get a once a year shot at making a change.
Yeah. So how do you help somebody decide, to go with a Medicare Advantage or a Medigap? Because I'm running this in my head and I'm thinking, okay, you pay a higher premium, but you're almost capped out of pocket. That's like the worst case, where you could maybe save $100 a month or more, but you might have to come out of pocket $9,000 in 1 year.
Yeah, it is a tough choice. People have to think about their usage. I have a chapter in my book that kind of walks through some of the most important questions. But the first thing you want to do, if you are able to afford both, let's say Medigap is in your budget, go to all your providers and ask them, hey, are you in the network for ABC HMO plan 4560, right? You want to use the exact plan name. And make sure that they're in the network. Maybe one of your important doctors says, I don't take Advantage plans. Well, that's going to tell you that if you want to keep seeing that doctor, Medigap is the route you need to go, right? And then you also want to check the plan directory to make sure to confirm what your doctor said, that they are in the network for that plan. And you really hit on something important, which is that when people choose a Medicare Advantage plan because it's cheaper, they often are concerned about, what if I get cancer on this plan, or what am I going to pay when I go in the hospital? So the good news is you could pair a zero premium Medicare Advantage plan with an inexpensive lump sum cancer plan and a hospital indemnity. And now you have sort of shored up some of the benefits on that plan that might have caused you to come out of pocket, and you are still spending thousands of dollars less than what you would spend over 5 years, say, for a Medigap plan. And so we often ask people, listen, you're going to have a network. Are you okay with treating local to home? Because if you're not okay with that, and you want that opportunity to go to the Mayo Clinic if you have a certain type of cancer and that's the best place to go, Medigap is really what you want in that scenario. But many people seek all of their healthcare at home, and they wouldn't go out of state for even cancer treatment because it's not convenient, right? And so if that's you, then a Medicare Advantage plan may work fine for you because you are okay with that local network.
Yeah, I guess that's something everyone has to ask themselves, right? What do you think you're going to want to do? Because yes, it's great to be able to go to the best hospital in the area, but if it's 2 or 3 hours away, that might not be realistic for you going there all the time, right?
Yeah. And for some people it isn't, And then there's costs that happen that people don't account for, such as you need to get a hotel in the city for your loved ones to, that's things that are not covered by insurance. So those kind of inexpensive cancer plans are really wonderful for taking care of those kind of costs as well.
So, as people are deciding upon this, obviously they can work with a broker, like it can work with you and your company. What are some of the things, like when you're looking at different brokers, to be asking yourself?
Yeah. So the thing to understand about working with a broker is that our service is free. It doesn't cost you anything. We get paid a commission by whichever insurance company that you ultimately choose. So when you're looking at a broker, you want to think about a couple of things. Number one, are they independent? Do they represent a bunch of companies so that they can not just be selling you this one plan? You want to have good choices. And then what kind of back-end support does the broker provide? Because when you get on Medicare and set your policies up, unfortunately, that is not the end of your decision making. There are going to be things that happen. There will be coordination of benefits issues that cause claims that get denied. There will be hiccups with a prior authorization that sends it into Never Never Land, and it's just waiting to be approved out there. There are drug exceptions, late penalty appeals, Maximus appeals, plan-to-plan exchanges, things that people would have no idea how to fix. And the most common thing that happens is you'll be on a policy and you'll get a bill in the mail and you'll have no idea why you're getting that bill. Is this something you actually owe? Well, if you enroll directly with the insurance company, you're going to figure that out all on your own. They don't have the team to go figure that out. At Boomer Benefits, we have a client service team with 75 agents on it who only are dedicated to our existing policyholders. So we tell them, when you get a bill in the mail that you don't understand, do not pay it. Call us first. If you get a bill for $257, you're going to say, oh yeah, that's my deductible, But if you get something weird, that's something you want to check on, because a lot of times you don't actually owe those bills. We started tracking back in October of 2021 all the claims from bills that people had gotten that we resolved and they owed nothing. And in just that short time, we have saved $3 million for our policyholders. It makes me worry that we have people out there that just get those bills and pay them because they don't know any better. And you can be sure that your clinic or doctor's office, they're not going to come track you down to pay that back. So you need to have a broker to help you on the back end so you're not alone in dealing with Medicare.
Anybody that's called an insurance company, it sometimes can be a difficult process. You're on the phone a while. You might not get connected with somebody who truly knows what's going on, and it can go on for a while.
Correct.
So it's great to have an advocate that knows what they're doing, that can help you to keep more of your money.
Yes, of course. And also just to reduce that stress level, right? Because a lot of times we will see, like in some of our reviews from clients, they'll mention, I worked on this for a month and got absolutely nowhere. And then I remembered I could call Boomer Benefits and they fixed it in 3 days. But that's just because we know the right departments to ask for. We know the 70,000 billing codes. We can advise a lab when they use the wrong code, and we can have the providers fix it and do a rebill. That comes from experience. And that's just a hassle then that is off your plate, and you don't have to worry about it.
That's great. Is there anything else you want to leave us with before we wrap up for this episode?
I would just say, if someone is listening to that and they're going to be new to Medicare in the next couple of years, do your research early. Listening to podcasts like this one is good. You can attend webinars. We offer a free webinar. You can find that at boomerbenefits.com. You can read books. You can watch YouTube videos. You can go to medicare.gov and do all of that learning ahead of time so that you can start thinking about ultimately what you want in the end. I hate it when we meet somebody and literally they're turning 65
Sure.
tomorrow and they need the coverage lickety
Yeah.
split. It's really hard to make that decision in one day because it's such a big decision and so much information. So give yourself the grace period of time, do a little bit of research, and that way when you actually call a broker and you're on the phone with them to make decisions, you have some questions, but you have the base knowledge down, and that's just going to make that process so much easier for you.
Definitely, yeah. And, this is episode 229. So if you go to retirewithryan.com/podcast/229, I'll give you a link to where you can reach out to Danielle and her team. And as I mentioned earlier at the beginning, if you want to get a free copy of Danielle's book, if you leave a review of this podcast, either on Spotify or Apple Podcasts, then just email me at help@retirewithryan.com with your mailing address. We'll be happy to mail out a copy of her book to you. Yeah.
That's
So
awesome.
definitely, this has been a great episode. I know we jumped around, but I think we got, some good information nailed down. And, thanks again, Danielle, for coming on and, being a repeat guest, and hope to have you back on at some point again in the future.
Of course. I've enjoyed the conversation.
Yeah,
Thank you
thanks
for
a lot,
having me.
everybody. And, look forward to talking to you next Wednesday, and I hope that you have a great week.